We know that CAR T cells work in CLL. There have been patients who have basically been cured of CLL with CAR T cell infusions. But of course, the problem with CLL is that often the starting material, patients who go for CAR T cell treatment have got very poor immune system because of previous therapy and the leukemia. And the material that we collect, the T cells that we can collect from these patients to make CAR T cells are not very good. So the responses are not consistent. So some patients respond well, others don't. Now, there have been studies at the moment which combine Ibrutinib with CAR T cell, or they give Ibrutinib before they collect the T cells for CAR T cell manufacture. And those studies are looking fairly promising in that Ibrutinib seems to be able to improve the quality of the T cells being collected and potentially improve the outcome, the rate of complete remission and cure. Can it replace allogeneic transplant? I think my personal gut feeling is yes, in the long term it will replace allogeneic transplant, but I think the main issue at the moment is number one, access, because it's quite hard to access CAR T cells for CLL, and secondly, I still don't think we've got the right formula worked out perfectly on how to do this in CLL just yet. I think certainly there will be a number of CAR T cell studies for patients with CLL that will be open for enrollment, possibly around the world in the next year. So I think that those are definitely coming. In terms of mainstream, I would imagine they will be about 5 years away. It will lag the other indications because at the moment the manufacturing is still not as good as we would like it to be.